Thanks to you at home for joining us this hour. I don't know if you ever look at the website for our show, at the news blog that we maintain here every day. I'm not pitching it or anything. I'm just saying, if you've ever noticed it, you might know that an excellent old pal of mine, a great guy, Steve Bennin, writes the Maddow blog. He's also a producer on the show. He serves as a kind of a policy guru and a political process guru for our whole editorial staff. And as such, every day, Steve gives me and all the producers on the show kind of a briefing as to what he sees as the landscape of the day's news and the stuff that's going to be on the blog later in the day and stuff that we ought to keep our eyes open for over the course of the news day. Well, today, at about 1 o'clock Eastern time, Steve sent a slightly panicked note to me and the whole staff. He basically said, just as a heads up, you guys, on a typical day, I'll start the day with 10 to 15 credible ideas for Maddow blog posts. This morning, I had 29. And that was before new stuff started happening. I've sort of never seen Steve kind of rattles like that. He's a very even-keel guy. But it has, in fact, been a very busy news day. And big new stuff, in fact, has kept happening all day. It started actually in the middle of the night last night with the almost unbelievable news that the Trump administration is going to ask the courts to take away health insurance from 21 million people who have it today. 21 million Americans. You or someone you know has health insurance today who didn't used to have it because of the Affordable Care Act, because of Obamacare. Republicans, of course, promised that they would kill Obamacare, that they'd get rid of it as soon as they were in power in Washington. When Republicans, in fact, got into power, when they got complete control of government after the 2016 election, in fact, they did not kill Obamacare. That's because, A, people fought like heck to stop them from doing that, and B, I think it's also because they scared themselves a little bit when they realized that what they were actually going to do was take health insurance coverage away from 21 million Americans. But for whatever combination of factors, despite their promises that that's the first thing they were going to do, Republicans actually elected not to do that when they were in complete control in Congress and in the White House. And so we sort of thought that was over for now. But then late last night, we got the news that the Trump administration has declared in new court filings that they will not defend any single little bit of the Affordable Care Act. They want the whole law struck down by the courts, all of it. And that means if Trump now gets his way, 21 million Americans will lose all health insurance just like that. Another 133 million Americans, that's half the country under the age of 65, will get to take a spin on the old roulette wheel because half of all Americans under the age of 65 have some kind of pre-existing condition. And now the Trump administration says they want insurance companies to be able to go back to not insuring you if they don't want to on the basis of the fact that you have a pre-existing condition. I mean, we got rid of that roulette wheel 9 years ago in this country with the Affordable Care Act. Now the Trump administration wants us to go back. Also, do you know anybody on Medicare? Everybody over 65 has access to Medicare in this country. People with disabilities of all ages have access to Medicare as their health insurance. If Trump gets his way with what he's trying to do now, everybody on Medicare will start paying more for their prescription drugs. They're going to have to start paying out of pocket for stuff like diabetes checks and wellness checks and physicals and all the other preventive care that's covered by the ACA. The Trump administration has now decided to tell the federal courts to strike all of that down, to kill the health care law in its entirety. They couldn't do it through Congress, even when they had complete Republican control there. So instead, they've decided they're going to use the courts to try to do it, which is exactly the kind of thing for which they have been so excitedly stuffing conservative judges onto the federal bench at a record pace throughout the time that Trump has been president. Now, with enough judges in place that'll take their side, they're hoping they'll finally be able to take away health care coverage from literally tens of millions of Americans. They figured out how to do it. They must be so excited. According to exit polling from multiple sources, the last elections we had, the 2018 midterms, they were mostly a referendum on the issue of health care. For everything else that we fight about and for everything else that dominates the news, Americans who voted in the congressional elections in 2018, in November, say they were motivated more than anything else by the issue of health care. And with that motivation, they voted for a bigger Democratic sweep in the House than at any time since the immediate aftermath of Watergate. Now, in the wake of that, the Trump administration has set their course for 2020. And to set that course, they are asking the courts to put literally half the country out of the running for health insurance if you've been so unlucky in life as to have any one of a gazillion different pre-existing conditions that insurance companies will once again be able to say, make you uninsurable at any cost. It's just amazing. Walter Dellinger, former Solicitor General of the United States, very widely respected legal mind, he weighed in on the Trump administration's decision on this today. He called it, quote, not just legally indefensible, but politically insane. That is what they're doing. We will have more on that coming up this hour, including first-term Democratic Congressman Lauren Underwood, who ran very strongly on the issue of health care, who flipped a district from red to blue and became a freshman member of Congress. She's going to be joining us later on this hour to talk about that decision by the Trump administration and what it means going forward of what's going to happen in Washington from here on out. Also today, with a vote in the House that failed to override Trump's first presidential veto, the Trump administration also signaled that they plan to proceed with plans to take away money from the U.S. military to instead pay for President Trump's wall between the U.S. and Mexico. That said, the Democratic chairman of the Armed Services Committee in the House, Congressman Adam Smith, today denied a request to take funds that Congress had appropriated to the Army for other purposes to instead spend those monies on a wall, which means in addition to all the states and other entities that are suing Trump over him declaring this ersatz emergency to allow him to build that wall, it now looks like Congress will push this into the courts too. For every dollar that Trump tries to take from some other purpose to instead spend it on his wall. So you take those two things together, and I mean, it has been a day with lots of news in it, but it's also been a day when a lot of the news that broke is big news. I mean, among other things, we learned today that the Trump administration's legal firepower from here on out, from here at least until the next election in 2020, is going to be devoted in the courts to trying to take health insurance away from tens of millions of Americans to make them all uninsured. And they'll be fighting to take money away from U.S. troops to instead build Trump a wall that most Americans do not want. Which I guess is a nice double-barreled strategy for the president's re-election campaign. I'm sure they think that is.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.